Hello there. Greetings. My name is Dr. Okwadi DECAY, a dental health practitioner. Today, we have business to discuss about. We shall be tackling specifically issues of progression of tooth decay. Call it rotting of the teeth. First of all, it's very important for us to note that tooth decay process is critical. Critical in a manner that it undergoes certain processes. The processes are four, and you need to understand them. But before we get there, colleagues, ladies and gentlemen, viewers, you also need to get to understand that for a tooth to decay, there must be very critical, important factors. And these factors are four. The most important factor that we get to understand is the factors. Number one, the structure of the tooth. Let's talk about the tooth surface. Number two, the bacteria which is involved in the mouth. Number three, the food, especially carbohydrates. And number four, the time. Let's try to connect the dots. For a tooth to decay, ladies and gentlemen, there must be a tooth in the mouth. Without teeth, there is no tooth decay, because nothing is there to rot. So a tooth can only decay when it's in the mouth. But what are we discussing about? A tooth has got a certain structure, like what we can see here. This is very important, and this is very critical. A tooth to decay, there must be retention sites. This is a structure of a molar, as you look at it. And when you look at this kind of tooth structure, you find that they are retention sites. This is a typical structure of a molar. And when you eat food, there will be retention sites here. So when we talk about a tooth structure, we are referring to the surfaces of the tooth. There are some structures that promote the retention of food. Once that food is retained, then it will attract bacteria, which is already in the mouth, which could have been useful bacteria anyway. So we need to understand that the structure of a tooth plays a very big role in tooth decay. Teeth that have got retention sites will actually attract bacteria on that tooth structure, because the food is already retained there. So bacteria looks for food, and not just any food. They look for fermented carbohydrates, because that is how the tooth decay process starts. So factor number two, apart from looking at the tooth structure, is food. The food we are talking about, ladies and gentlemen, is the carbohydrates. Well, we all know that carbohydrates are energy-giving foods. They are very important. Without energy, you cannot do anything, because carbohydrates give us energy. They are energy-giving foods. Therefore, they must be eaten. But I'm not just talking about carbohydrates generally. I'm talking about fermented carbohydrates. When we talk about fermented carbohydrates, in simple terms, we are talking about those sugars that are gotten from foods that have been fermented. We can give an example. Soda. You take soda on daily basis. Good thing to do. Take soda. But you remember to brush your teeth anyway. But it's also important that if you must take it, use a straw. Shoot a straw beyond the teeth, such that the soda just lands in the stomach without necessarily touching the tooth surface. But we are also talking about biscuits. We are talking about toffees. We are talking about sugar itself, ordinary sugar that you use at home. It is very important in the tooth decay process. What are we saying? Anything which is packed and it has come through a factory is not friendly to your teeth. Why? The bacteria can easily convert it into an acid, and once an acid is converted, the sugar is converted into an acid, then that acid will be able to dissolve the enamel or the tooth structure gradually. So that is factor number two. which we have called food, and we're basically talking about fermented carbohydrates. Factor number 3, very critical for a tooth to decay, there must be bacteria. Bacteria is always in the mouth. Fortunately, we have got useful bacteria and harmful bacteria. In science, we call this normal flora. Normal flora basically is everywhere. It is in your mouth. It is in the tears. Sometimes don't waste your tears all the time you want to cry. It is in the vagina. It is on the skin. It is everywhere. It is useful in such a way that it's supposed to be protecting your body against the invading bacteria. Similarly, in the mouth, we have got bacteria. So this bacteria is supposed to protect your mouth against the invading bacteria. Unfortunately, if this bacteria is given food, it becomes violent. It is like you giving your guard, say a policeman who is guarding a bank, you give a policeman a lot of alcohol, he is going to get drunk, he will not protect you. So in this case, if you give bacteria food and you are giving it sugar, what will happen? It is going actually to produce an acid. And this acid, the moment the acid is produced, then it will burn the enamel or the tooth structure. It is very important for us to note that there is also a factor of time. That's the first one. Number 1 is a tooth structure. Number 2 is food, carbohydrates, and we're talking about fermented carbohydrates. Number 3, we are talking about the bacteria. And number 4, ladies and gentlemen, we are also talking about time. Time. I want to connect these dots. If you give bacteria time to look for sugar in the mouth that you have voluntarily or involuntarily put in your mouth, it will actually cause a lot of conversion of that sugar into an acid, which acid will gradually melt your tooth down. Okay? This is very important. I will say this again, that the 4 factors are a tooth surface. The second one is carbohydrates, which are fermented. The third one is bacteria. The fourth one is time. And let's connect the dots. If you give bacteria time to look for sugar in the mouth, it will convert it into an acid and it will dissolve the tooth surface. That's how tooth decay happens. Ladies and gentlemen, now let's go to the real thing. Now, if these factors are involved, it means all the 4 factors are involved, it means tooth decay process will actually take place. However, it is very important for us to note that all of the 4 factors are very crucial. But the most important factor in tooth decay is the time factor. What am I saying? We cannot stop you from eating biscuits. We shall never stop you from taking tea in your home. We can't stop you from eating whatever you want, whatever has sugar. But do not give bacteria time to look for these sugars. So what are you going to do for me? Make sure immediately after eating your biscuits, drinking your tea, whatever you want to eat, the biscuits, remove it from the mouth as soon as you can. What will you have done? You'll have disconnected the bacteria from coming into invading whatever food is there, and you'll have stopped the tooth decay process. Tooth decay process starts almost immediately. You bring the sugar in the mouth. 5 minutes later, you'll have been seen disaster. We have all taken soda. That soft drink is good. Personally, I enjoy it. And sometimes when I'm in my surgery here and I need glucose, the first thing I will go for is a bottle of soda. But of course, I'm wise. Wise to the extent that I will pick on a straw and sip the soda. It lands in the stomach without necessarily touching the tooth surface. What we ought to avoid is the sugar to touch on the tooth surface. But most importantly, because we don't want sugar in the mouth, get your toothbrush, brush the sugar in the mouth immediately. But better still, you can use water, rinse, but that might not be as effective as possible. But we also normally tell you, if you must brush just once, maybe before you go to bed, because it is longer for you to have sugar in the mouth the whole night. By morning time, you will feel some kind of alcoholic smell, meaning there has been a lot of fermentation that has been taking place in your mouth the whole night. Ladies and gentlemen, it is therefore very important for us to note that time factor is more crucial in tooth decay than any other factor. You can't stop people from eating, they have to eat. You cannot stop bacteria from being in the mouth. It has been manufactured to be there to protect your mouth, but unfortunately, so long as you continue giving the bacteria food, it is going to colonize the mouth, and at the end of the day, you find all kinds of colonies of bacteria accumulating in your mouth, hence bringing disaster. Let's look at the tooth decay process. Tooth decay process is also in 4 levels. Level 1, for a tooth to decay, first of all, let's look at the parts of the tooth structure. We have got the hardest part of the tooth. We call it enamel. We all know that enamel is the hardest part of the tooth. Unfortunately, we misuse it. If you look at this tooth structure, this is a tooth structure of a molar. Very, very important. This is a molar. But I want you to look at this part, which is shaded blue. This part is what we call the enamel. Enamel happens to be the hardest part of the body, let alone the tooth. Why? Because of its mineral content. It contains over 90% calcium. That's why we normally say, once a lady has conceived and she knows she's pregnant, she's supposed to attend antenatal. And when she's attending antenatal, the nurse, the midwife, will be able to give them some health education, among which is also dental health education. And during the time of tooth development, you ought to give this lady a lot of calcium foods. Milk is one of them, so that we can have the enamel develop well. Sometimes anyway, people ask whether children are born with teeth. Yes, there is a difference between tooth eruption and tooth development. Tooth development begins at the 2nd trimester. That is when a lady is 6 months pregnant, meaning a baby will have started developing teeth when that baby is 6 months in the mother's womb. And that's now the time when this enamel is formulated. And for this enamel to be hard, the structure of enamel is going to be determined by the level of nutrition. High calcium nutrient will give you the hardest part of the enamel. Unfortunately for enamel, what makes the enamel are cells. We call them ameloblasts. This may not be very important for you, but what is important for you to understand here is that these cells are suicidal. Suicidal in such a way that immediately after accomplishing their tasks, they die, just like suicide bombers. But let's get to the point. Is that the reason why enamel is brittle? Yes. Why? Because the cells that make enamel, they die immediately after accomplishing their task. But guess what? We all often misuse our teeth. What do? We use the teeth for opening bottles of soda, opening bottles of beer, cutting wires with the teeth. And sometimes, unfortunately, when you are reckless, you may fall down. Border has also caused it. If you have no element, please take care. Your teeth will go.